Enteroscopy means endoscopy of the small bowel. So traditional endoscopy or gastroscopy is looking at the stomach, the food pipe, the stomach, and the first part of the small intestines, and the camera doesn't go in very far. But to try and have a look in the small bowel requires a longer telescope because the small bowel is much longer, and it varies from person to person. But it's quite difficult to get to, and for a long time it's been very challenging to be able to introduce a telescope down into the small bowel. Around about 10 years or so now ago, maybe a little bit longer, uh, uh, an instrument was developed which includes an enteroscope or a longer telescope with an overtube, and the overtube has a balloon that can be inflated and deflated, and when that's introduced from the mouth down the food pipe in the stomach and into the small bowel, that balloon can be inflated and holds on to the small bowel so that the telescope or the enteroscope can then be pushed further down into the bowel. That overtube and the balloon is then deflated, the tube pushed down further, the balloon reinflated, and then everything pulled back, so that you can then get the telescope even further down, repeat that process by deflating the balloon, reinflating it when you push the tube further down into the bowel, reinflating everything, pulling everything back a bit further, and then introducing the telescope even further down into the small bowel. So it's almost like putting on a pair of tights or putting on a sock as you're pulling the bowel further and further up and inserting the telescope further down. So it is an invasive technique in order to put this camera much further down into the gastrointestinal tract than we've been able to historically, and it's often done under sedation with analgesia because it's a slightly longer procedure and can be a little bit more invasive than a traditional endoscopy or gastroscopy. A balloon enteroscopy is designed to look at the small bowel. So the enteroscope is introduced further than a gastroscope into the small intestines. And that allows the endoscopist to look further into the small bowel than traditionally able to with the older telescopes. So an enteroscope or a balloon enteroscope is designed to treat any disease process that might be occurring in the small intestines. So not only diagnose, but sometimes take biopsies or tissue samples of the bowel wall, looking for inflammation, from example, from Crohn's disease, or biopsies if you're suspecting celiac disease or other pathology. But you can also apply therapeutic measures. You can actually try and do something to help alleviate symptoms. If there's bleeding from a blood vessel, the endoscopist might be able to clip or inject or spray a bleeding blood vessel. Or if there's a fleshy lump or a polyp, we're able to remove that polyp endoscopically and retrieve the polyp and then analyze it. So it's designed to treat specifically small bowel disease when pathology or disease has been suspected or demonstrated in that part of the gastrointestinal tract. So patients may normally be put forward for a balloon enteroscopy if disease in the small bowel has been suspected or perhaps demonstrated on other investigations. So patients may have had a capsule endoscopy to look in the small bowel, which may have highlighted a finding or potential disease, or they may have had a CT scan or an MRI, or there may be a family history of certain disorders or diseases such as inflammatory bowel disease, which might alert the physician or doctor that there may be disease further down in the small bowel. And if biopsies or tissue samples are needed, or if there's bleeding that needs to be stopped, or if there's a polyp that needs to be retrieved, then a patient may then undergo a balloon enteroscopy in order to have a therapeutic procedure undertaken once they've had a diagnostic investigation beforehand, such as imaging or a capsule endoscopy. It depends on what you're trying to achieve. I think balloon enteroscopy, because it does involve inserting the long telescope quite a long way down into the bowel, it can be a more invasive procedure. It can take longer and be a little bit more uncomfortable than a traditional endoscopy or gastroscopy. So we'd really only want to undertake that procedure if there was a the need to take tissue samples or do something therapeutic, such as stop bleeding or remove a polyp. It wouldn't be used in the first instance as a diagnostic tool because it's quite an invasive test, and I think we'd look at capsule endoscopy or an MRI of the small bowel or some other means of investigation first to try and diagnose a problem that then needs therapeutic intervention. So it's incredibly effective if you require biopsies. It's very effective if you need to stop bleeding in the bowel. It's effective in removing polyps if you need to have a polyp removed. So it's a very effective means of being able to undertake a therapeutic procedure if that's what's required. Balloon enteroscopy or any form of enteroscopy, which involves an endoscope introduced down into the small bowel, is a more invasive procedure than a gastroscopy or traditional endoscopy. The latter is looking at the food pipe, the stomach, and the first part of the small bowel, and that test usually takes about 5 minutes to do. Whereas the enteroscopy is a much more involved procedure, and really, if you're able to get the telescope deep into the small bowel, such a procedure might take 20 or 30 minutes or even longer sometimes. And because it's a longer procedure with a longer telescope being inserted, that procedure can be a little bit more uncomfortable, which is why we'll give throat spray to take away that gag reflex and take away any sensation in the back of the throat. And the patients usually have sedation and pain relief as well to make them sedated, what we call conscious sedation. It is, as with all procedures, when it's an invasive procedure, there's a very small risk of untoward events such as bleeding or causing a tear in the bowel, but these are incredibly rare procedures, so it certainly is a safe procedure to undertake.